Assalamu alaikum. Welcome all to the Human Anatomy channel. This is a podcast upper limb bones. In this podcast, I discuss the clavicle. What type of bone is clavicle? It is a modified long bone. It has two ends, medial and lateral, shaft having S-shaped curve. It has no medullary cavity and only one secondary ossification center. What is the anatomical position of clavicle? The flattened acromial end lies laterally, expanded sternal end lies medially. Group 4 subclavius is directed inferiorly and medial 2/3 of the bones is convex forward. What are the parts of the bone? It has three parts: shaft, sternal end, acromial end. What are the surfaces of the shaft in the medial 2/3 of the clavicle? Anterior surface, posterior surface, superior surface, inferior surface. What are the function of clavicle? It supports the shoulder laterally and backward, help the swinging of arm clearly away from the trunk, transmission of the weight from the limb to the sternum. What are the peculiarity of the clavicle? It is the only long bone that is placed horizontally in the body. It is a modified long bone. It is devoid of medullary cavity. Although it is a long bone, but it ossifies only from membrane. It is the first bone to begin ossifying and the last to complete ossification. It is subcutaneous throughout. It may be pierced by supraclavicular nerve. Name the bones that articulate with the clavicle. The sternal end or medial end articulate with the manubrium sterni, the clavicular notch of the manubrium sterni, and form the sternoclavicular joint. It is the saddle variety of the synovial joints and joint cavity contain articular discs. The acromial end is articulate with the acromion process of the scapula from acromioclavicular joint. This is the plain variety of synovial joint. What are the parts of lateral 1/3 of the clavicle? The lateral 1/3 of the clavicle has two borders, anterior border, posterior border, and two surfaces, superior surface, inferior surface. What are the muscle and ligament attached and structure related to the medial 2/3 of the clavicle? The superior surface of the medial 2/3 of the clavicle is smooth and covered by skin, platysma muscle, and medially it provides attachment to the sternocleidomastoid muscle. The nerve supply of the sternocleidomastoid is spinal root of the accessory nerve. The inferior surface is a rough impression near its medial surface which provide attachment to costoclavicular ligament. A shallow groove is present in the inferior surface and this groove is attached by subclavius muscle. The margin of the subclavius groove is attached with clavipectoral fascia. Anterior surface of the medial 2/3 of the clavicle is convex anteriorly, provide attachment to the pectoralis major muscle, and its nerve supply is medial and lateral pectoral nerve. The posterior surface is smooth and convex posteriorly and related to the trunk of the brachial plexus, subclavian vessels. Medial end of the posterior surface provide attachment of the sternohyoid muscle. Name the muscle and ligament attached and structure related to the lateral 1/3 of the clavicle. Anterior border is concave anteriorly and provide attachment to the deltoid muscle. The nerve supply of the deltoid muscle is axillary nerve which arises from the posterior cord of the brachial plexus. The posterior border is convex and posteriorly provide attachment to the trapezius muscle. This muscle also supplied by the spinal root of the accessory nerve. The inferior surface has a coned tubercle near the posterior border and a thick ridge, trapezoid ridge, extend from forward and laterally from the coned tubercle. They provide attachment to coned and trapezoid part of the coracoclavicular ligament. This ligament is very important, is transmit weight from the upper limb to the axial skeleton. When and how does clavicle ossify? Most of the shaft of the clavicle ossify by membranous ossification, except for the medial end. It ossify by two primary center of ossification in the shaft appearing during the 5th to 6th week of intrauterine life. One secondary center of ossification appear at the medial end between 15 to 20 years of age. This fuse to the shaft at about 25 years of age. What are the ligaments are present at the sternal end? The capsular ligament around the margin of articular surface, anterior posterior sternoclavicular ligament, and interclavicular ligament and costoclavicular ligament. The posterior relation of the clavicle behind the sternal end, formation of brachiocephalic vein. On the right side, origin of the brachiocephalic artery. On the left side, left common carotid and left subclavian artery, internal thoracic artery, lungs and pleura. Behind the body, trunk of the brachial plexus and suprascapular artery. What are the difference between male and female clavicle? Male clavicle is long and rough and more curved. Female clavicle is short, smooth and less curved. Male clavicle is thicker and more muscular impression. Female clavicle is thinner and less muscular impression. The acromial end of the male clavicle is slightly higher than the sternal end. In female, acromial end is slightly lower than the sternal end. From where the nutrient artery of the clavicle came, suprascapular artery. Now the applied anatomy of the clavicle. What is the most common site of the fractured clavicle? The junction between medial 2/3 and lateral 1/3 of the bones is the common site of fracture. It is the common site because it is the point of weight transmission of the upper limb. Strong group of muscle are attached on both sides. One side is deltoid and another side sternocleidomastoid and pectoralis major. It is the junction of the two curves. At this point, nutrient foramen lies. So these are the cause for common fracture site of the clavicle. What is cleidocranial dysostosis, dysplasia? It affects mostly bone derived from the intermembranous ossifications such as the cranium and clavicle. It characterized by the delay closure of the cranial suture, hypoplastic or aplastic clavicles and multiple dental abnormality. So this is all about today's postcard. If you like this postcard, please share this postcard and thank you for watching, and please support my channel by subscribing. Thank you for watching.